Hi, my name is Ioannis Kondolatis. I'm an orthopedic and trauma surgeon, and today we're going to talk about injuries in your knees, especially injuries in menisci. The menisci are two structures that they are inside the knee and they help reduce the stresses applied. We can see in this model that the menisci are between the thigh bone and the tibia. They are these blue structures, okay? And usually they are injured by a twisting injury, which is quite common in footballers, but also in everyday life. And there is also 20% of injuries in these structures that they are unrelated to any incident of twisting or anything else. Usually we have knee pain, effusion, and difficulty in walking. Occasionally we might have the knee locked in a semi-flex position. You should rest it, elevate it, and use some ice packs for 20 to 30 minutes every 2 hours. Be careful not to apply the ice directly on the skin. If the pain persists, you should visit your orthopedic surgeon. Your orthopedic surgeon will do the clinical examination, which is the cornerstone of diagnosis, and if there is a strong indication of a possible injury in your meniscus, then he might suggest that you should do an MRI. There are conservative way of treatment of this injury and operative treatment. The conservative treatment is mainly exercises, rest, elevation, and conditioning of your knee, which can be done alone or with the help of a physiotherapist. If the pain persists, then you might have to do an operation, which is arthroscopy. The indications of operative treatment in meniscal injury are mainly two. One, which is an absolute indication, is if you have incidents of locking of your knee, meaning that while you walk, your knee becomes locked in a semi-flex position and you momentarily lose control of your knee. This is very dangerous if it happens when you walk and cross a street or when you drive. And that's why it's an absolute indication to do something about it. The second indication, which is by far the more common, is persistent pain that causes difficulties in everyday living. What I usually say to my patients is that they should do exercises for a period of 2 to 4 weeks, strengthening their quadriceps muscles mainly, and also the hamstrings. After that, they should gradually try to return in everyday activities and whatever they want to do with their life, work, hobbies, or whatever. By doing this, they will fall in one of three categories of patients. One is, doctor, I'm very well, I'm feeling very nice and I can do everything. If you are lucky enough to be in this category, then you should proceed with your life and no worries about it. The second category is, doctor, I have the occasional discomfort, but by taking paracetamol and doing some exercises, I can do my work, I can do my hobbies, and on most occasions, you are allowed to continue to do what you are doing, and if things get worse, then we would consider an operation. The third category, which unfortunately is the most common one, is that the patients say that, doctor, we have improved, yet when I'm trying to do something like playing football or basketball with my friends, go hiking, or whatever hobbies one might have, I have some discomfort and it doesn't allow me to do what I want with my life. In this occasion, we proceed with the arthroscopy, with operation. The arthroscopy consists of making two small holes, entering and washing out the knee. It's the absolute diagnostic tool because we can see exactly what is going on, and we usually trim the broken meniscus in a stable border. There is a small percentage regarding the injury of the meniscus, and if the tear is in a suitable zone, that we might stitch it. If we do what we usually do, the trimming, then the post-op regime is you can fully weight bear immediately after the operation, and you have a quite rapid recovery that might vary from 2 to 4 weeks. If we stitch the meniscus, which is done not so often in an isolated injury, then we have to protect the operation and the stitching, and the post-operative period that you will have restriction is approximately 2 to 3 months. In general, if you have pain that persists, you should visit your doctor and you should follow what he suggests. I hope that this gave you useful information regarding knee injuries. Thank you.